Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. As you know, I pre-record these shows. Today is our snow day here, the week after Valentine's, and everything's pretty much closed, but I live so close, and my wife would say, "Oh, you could have probably walked to the station." It's like, I could have, because actually when I would go out on my morning walks, I actually walked past the radio station. It's that close to my house. But there's a couple hills, and after falling and breaking my knee a couple years ago, I'm really cautious when I'm on slippery surface, so I decided I didn't even consider walking. I did take a little bit different route. The shortest way out of my neighborhood, there is a steep hill with a curve, and it's like, I don't want to try going up that. I could slide. So I went ahead and came in to do the radio today and get some stuff out. I'm going to try not to be political on this, but the political ramifications are going to play into what I'm talking about today. We are in a new administration. We've had election. And I realize, I am on the conservative talk radio station. So generally, most of my views, if I'm expressing my views, which of course there's always a disclaimer at the beginning of the show that they aren't necessarily the views of this station. So I'm free there, but I still have to be careful. I don't want to offend potential clients, and I do make a YouTube out of these shows, so anybody could be listening to them, not just those that tune in to WHUB. But I could still talk about some of what I consider to be realistic assumptions and predictions with the Healthcare and Medicare Marketplace, and some of the changes that probably are going to happen in this administration, and some of the things that happened in the previous administration that I didn't like. And there was a couple of things in there that I did like, and I think some of those may go away too. So there's going to be some changes, and that's really kind of the focus of what I want to talk about today. Is there's going to be changes. Some of them are going to be uncomfortable for some. Some are going to say it's about time. One of the things I want to talk about, I generally don't talk that much about insurance companies, but I do want to kind of go back on, a lot of the bad press for United Healthcare. And I'm not here to defend United Healthcare. I'm not a United Healthcare apologist, but they're a huge company, and I write a lot of business with them. They're not my only company, not the only company I write with. I pretty much, I kind of spread it out. And again, because I take an approach that we're going to figure out the plan that works for you. And one of the things that happens there are networks. And sometimes it's, this plan is a great plan. It's got great benefits, but your doctor doesn't take it. Or you're on a certain prescription and it's either not covered or very high with that plan. So we're going to find what fits you. And I'm not going to rule out United Healthcare as being one of those sources. But the bad press that came up when the CEO was murdered there a couple months back, there was a lot of talk about all their declines and 30% of their declines. And I actually got a good source on that, was a company that I'm working with. I say a company, another organization of agents. And they write a lot of business there too. And I said, if there was 30% denials on all claims, they'd be hearing a lot more complaints from their clients, and it just wasn't happening. So the number was very inflated. Yes, there's going to be declines. There's going to be appeals that have to be, and that's the thing too. Some of that stuff, sometimes there's an initial decline, and a lot of times those declines are not that they're to decline the care, but the prior authorization was not submitted correctly. And so it gets turned down, and they go back and go, "Oh, you check this box. Of course, we're not going to approve that." There's certain procedures that are only covered if they're for certain things. One of the big things, I've seen a lot of commercials right now about the GLP injections for weight loss, and most of those aren't going to be covered by insurance for weight loss, but they are covered for diabetes. So that's one of the things. Those are some prior authorizations that get turned down. The other is going to a dermatologist to have a growth, a mole per se, or something removed, and then Medicare doesn't cover it because it wasn't cancerous or presumed cancerous and removed for a biopsy or something like that, because that would be considered cosmetic. You're having it done for your convenience, not because it's medically necessary. So a lot of times, some of those things will be declined for that reason, and that happens across the board. One of the things I thought of is, as I mentioned, United Healthcare is a huge company. They're number 4, number 5 on the Fortune 500 list of United Health Group. So they're going to have negative press. There's going to be negative reviews. Everybody, I'm probably cursing myself right now because fortunately, my Google reviews right now, I have all 5-star reviews. It's great. I love it. The people who really appreciate what myself and my staff have done for them, they love to give us a 5-star review. Do I think I'm going to always have 5-star reviews? No. It's kind of funny. I do my welcome to Medicare workshops, and we ask people to kind of rate, and a lot of people give me 4 stars. But then their comment will be great information. I learned a lot, but they gave me 4 stars because some people just think, hey, I am not going to give 5 stars. It's like it has to be above and beyond for me to do 5 stars. So, if you get 1 or 2, you're going to understand that that's going to happen. And I haven't made everybody happy. Fortunately, the ones that I haven't made happy have not given me reviews. I appreciate that. And sometimes sometimes they're not happy, but it's not necessarily, something that I did wrong, or sometimes it's just they didn't understand, what they were getting. They thought that I was telling them they're getting this. And I've tried very hard to make sure that when I explain why I'm writing a certain policy, why I'm recommending that policy and not just, hey, I'm going to get a commission here, sign here, because those policies aren't going to stick, and I hate chargebacks. So I'd rather not write the policy than write something you're going to cancel after a couple months because you're like, why am I paying for this? I don't even understand what I got. So, and the thing is, and if I have written a policy like that and you're going, I don't know what I've got, call me. Let me explain why I recommend it, because a lot of times I've had clients call and go, why do I have this again? And I explain, oh, yeah. I just had a recent appointment with a lady that was one of my Medicare workshop clients, and she was on a Medicare supplement plan, and so she's had to pay like her deductible. She's had some out-of-pocket costs. And the other thing that was concerning her was she was getting a lot of bills from her providers. And I was like, don't pay the bill. Just hold up. Wait until you get that EOB, as we call it, the explanation of benefits from actually you should get from Medicare, but also from your Medicare supplement company, and because they'll show what they paid. Because a lot of times what they're doing is they know Medicare pays them right away, but they may be still waiting, a month or 2 before the Medicare supplement picks up their portion. The other thing I reminded her was, hey, we're early in the year. It's February. You had a $257 deductible, so you may actually owe that bill because you hadn't paid your $257 yet before Medicare starts paying their 80%. So a lot of times sometimes it's confusion, but don't sit and dwell on it. Give us a call, even if you're not our client. If we can answer a lot of general questions. We can't get into specifics necessarily of your plan. We can't call the insurance company on your behalf if you're not enrolled with us. And I know I run into a lot of times people will come to one of my workshops, or they're local and they got signed up over an 800 number, or someone had called them from out of state a year or 2 ago and they never hear from that person again. And they're like, and they come in with questions like, I really want you to be my agent, but I've looked at everything and didn't change their plan. And they're like, but I still want you to be my agent. Most of the time, that's not going to happen. There are some procedures to switch what we call agent of record. I mean, sometimes they'll appoint us as we can be agent of record. We're still not getting commission on that plan, but we do have the authority to be able to call and ask questions on that person's behalf. So it's something we can still help with. And I don't mind doing that. I mean, yes, I would prefer to get paid, but if I can help someone, they're gonna send me referrals, and they may come back with something else. And a lot of times I can't help that person. I can't get their Medicare plan, but their spouse is turning 65 in the coming year, and then I'm going to get their plan. So it still works out. At the end of the day, a happy client's, a happy client. So anyway, one of the things I wanted to kind of get into, I've talked about the Inflation Reduction Act. One of the things that did was it changed the drug coverage, the Part D with Medicare, with there being a $2,000 maximum on your prescriptions. Now, of course, there's some caveats there of make sure that drug is on the formulary of your plan. A lot of people didn't check that before during the annual enrollment because they've been paying the same every year, their monthly premium, and they didn't pay attention to the fact that that low-cost drug plan that you have, that company's not offering that plan anymore, and they're moving everybody to such another plan that's like twice as much premium. So some people got caught that way. I've had a couple people that have contacted realize that, they don't have their drug plan anymore because the company quit offering drug plans. So we're still in the window. We've got, actually, depending on when this show airs, maybe past that 60-day window for Part D drug plans to switch because of loss of the plan leaving the service area. And some of the Medicare Advantage plans did that also, that some of the outlying counties, some of the plans are not available in those counties anymore. So that's something to double check. Because if you haven't been to the doctor, you go to the doctor once about every 6 months, and you went in November and you're not going to go again until May or June, you may find out you don't have a Medicare Advantage plan. Or you go to the pharmacy to pick up a prescription and they say you don't have any insurance. Double check that. If you're not sure, give us a call. We can help figure out whether your plan's still effective. Of course, you still have a customer service card. Your member card has a customer service number on the back. Give them a call and double check to make sure your policy's still in effect. Now, they'll say, if it's not, they're going to say, well, let us put you over to our sales department. And they say, no, thanks. I got a guy here local. And then come see me. We'll get you taken care of. The other thing on that was on the Part D was they did because of that $2,000 maximum, the cost to the insurance companies after you hit that $2,000 maximum, they have to cover 60% of the cost now, where they were only covering 15 or 20 previously because you were paying copays and that. So they've adjusted those costs there other places, and I've talked about that before. But one of the things that happened just prior to the election was all the insurance carriers submitted their proposals to Medicare saying, hey, this is what we're going to charge for the premium. This is what we're going to have for the copays. And the same thing with the Medicare Advantage plan. We're going to drop this benefit and drop that benefit. And that's not a good move for an administration that's trying to win an election just before, when we're doing the enrollment season, just before election time. So they decided, we need to prop that up. So they came up with funds, and I'm really curious of where they're going to figure, investigations may come back and say, how much fraud there was in that. But they did a test program that supported the insurance companies to cover a lot of those costs, so they weren't going to have to eat those costs this year so much, even though they're going to get reimbursed for some of those. So they lowered the premiums on those plans that were going to go up quite a bit. So for 2026, I expect quite an increase in your Part D prescription costs, which will, also change costs in reduced benefits on Medicare Advantage plans. I notice we're coming up on the break here, so I'll go a little bit more into detail on that, and then I'm going to address some of the things that affect the Affordable Care Act plans. So stay tuned. We'll be right back.
Need a little help with home repairs? The Habitat for Humanity Critical Repair Program is here to lend a hand. We're accepting applications now through February 14th for non-emergency repairs like plumbing, roofing, and more. Visit uchabitat.org and click the Critical Repairs Program tab to apply, or stop by our office at 1546 East Spring Street, Suite B. Don't wait. Applications must be postmarked by February 14th. Habitat for Humanity, helping you make your home a better place. Equal opportunity provider. Discrimination is prohibited by federal law.
Did you know all internet services aren't the same? Differences in speed, reliability, and cost can make a big impact on your daily life. That's why Twin Lakes invested in fiber technology to bring vital broadband services to our communities in the Upper Cumberland. With fiber, you get the fastest, most reliable internet around, perfect for streaming, gaming, and staying connected. Experience the difference that fiber makes. Learn more at 800-644-8582 or visit twinlakes.net.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, we're back with Insurance Matchmaking, and I was talking about just before the break there how some of the changes are, because of the Inflation Reduction Act, are affecting the Part D coverage, which affects the separate Part D prescription drug plans and also the Medicare Advantage plans. So one of the things that, like I said, didn't happen was the premiums did not go up on the drug plans, or didn't go up as much, because they did get some support to kind of prop that up. Two companies in our area, I don't know, there probably was more throughout the country, but if you had a Mutual of Omaha or a Farm Bureau drug plan, and that's what you think you still have, those plans don't exist anymore for separate Part D plans. So if you had those, you need to get a hold of us soon and see if we can't get you a drug plan for this year, because if not, then you will be paying 100% for your prescription costs, and you will end up next year with a late enrollment penalty when you re-enroll in a plan because you had a year that you didn't have drug coverage. Now, it won't be a lot. It'll be about $3.50 to $4 for the year, but the problem is that will never go away, so you'll always have that premium added to your drug plan. So if you think maybe your drug plan doesn't exist anymore, get a hold of us. The other thing is with the Medicare Advantage, let me back up. So we had the two companies that left doing the Part D plans, and then some of the plans cut out some of their plans or made some of their plans non-commissionable, which means we don't want to talk about those plans because we don't get paid anything for writing you, and we didn't get paid a lot for them anyway. One of the big companies, I'm not going to say their name because that could be kind of misconstrued, they went to one plan, and that's what I mentioned. Like, some of the people were paying, I think it was $7.50 for their plan, and then another plan that was like maybe $20. They combined it all in, and they have one plan that's $40-some. So that's one of the things. And there's some of the companies that their premiums went up, but if you have brand name prescriptions, they're covering it very well. And actually, I've got people whose costs are actually going down even though they went to a higher premium on their drug plan. It's hard to explain. I've talked about that on a previous show, kind of how that worked, but I'm not even sure I'm still clear on it. So that's one of the things that happened with the drug plans. I do expect in 2026 that the premiums will go up on all the drug plans. We may have other companies get out of the drug coverage at all. One of the things a lot of the plans they do is those that have low income and qualify for what's called the low income subsidy, also called extra help, which is programmed through Social Security, that will subsidize the drug costs. And so part of that subsidy is they will pay, and most of the time the whole premium, pay a portion of the premium, around $30 to $35 of the premium that's for drug coverage. And so some plans are even more than that, but it still covers that much of the drug plan. And so those that do have the lower income, what really helps them is they get that drug premium covered. They get a lower cost on their drugs. If they do not have to pay the Part D deductible, which can be all the way up to $590 this year. So next year, that will probably be over $600. And they don't have the late enrollment penalty. So if you are paying the late enrollment penalty and you can find that you're qualified for that low income subsidy, you can eliminate that penalty. So if you figure you're not drawing very much on your Social Security and that's your only income, and you don't have other assets like a second property or a 401k or something like that, or a pension, you could possibly qualify for that assistance, and you can apply for that assistance anytime during the year. So if you think you might qualify for that, get a hold of our office. That's something we help people with that application. You don't even have to come in if you don't want to. We can do it over the phone, but you are going to have to give us your Social Security number for us to be able to complete that for you, because we actually, through the Social Security site, submit that application for you, and part of that application is putting in your Social Security number. So I know a lot of times people are more comfortable coming in the office to do that. You can see the process. We can also set up a virtual meeting where where I can share my screen on a webcast. So that's something we can do there. So we can help that on the drug coverage. The other is on the Advantage plans. A lot of the plans did put drug deductibles on their plans, and some of them have dropped some of their benefits, reduced the over-the-counter or eliminated it completely. Some have eliminated or reduced their dental benefits. So all those commercials you've been seeing about all the benefits on these different plans, and they're still there in the Part B give back where they pay a part of your Part B. All those things are still existing, but some of them are not as generous as they were in the last couple of years, and I'm expecting them to be a little bit less generous this coming year. There was a lot of companies this year basically made some of their plans non-commissionable because they didn't want any more people on those plans because their benefits were very rich. They were getting more of the unhealthy people on those plans. So those are all some things that can change. We are still in that open enrollment period, still have until March 31st. That if you have a Medicare Advantage plan and it's not working out the way you thought it was because of changes that were made, and maybe there's another plan that might work better, we can still get you a new plan up to April 1st. So as long as we can do an application in April, application in February, your new plan would start on March 1st. If we do it in March, your new plan will start on April 1st. After that, we have to see if you maybe would qualify for some other special enrollment. So sometimes there's things that we can do during the year and still get you a different plan. So if you haven't really looked at your benefits, one of the things I've seen some posts, people, they're complaining that my mom's Social Security costs went up or her check, went down. And a lot of things they're not realizing is some of those premiums went up on their drug plans. Or my mom's insulin went up. Yes, there is a $35 cap on insulin, but the insurance company doesn't have to cover every insulin. So you've heard me talk about the formulary. That is their list of prescriptions that they cover. And so usually they'll only have one or two types of insulin, and there's like 3 or 4 different types. And my diabetic listeners are going to go, "You idiot, there's this," okay? It's fine. But so maybe it was covered last year and it was inexpensive, and this year they decided to eliminate. And that's, again, goes back to what we say. In September, you're supposed to get a letter from your Part D or your Medicare Advantage carrier called the Annual Notice of Changes. ANOC is what we call ANOC, ANOC. And it tells you this is what your plan is going to cost next year. This is what the copays are going to be. This is the changes in our formulary. This drug that was Tier 2 is now Tier 3. This drug that was Tier 4 is now Tier 2. We used to cover this drug, but next year we're not. This is the insulin that will be covered under the insulin price cap. So all those things come into play, and you need to review that. That's why it's always so important to review that drug coverage during the annual election period from October to December. And we like to try to get that in, get those drug lists in September. So on October 1st, we can review those real quick and say, yep, you're still good, or hey, you might want to change plan. This plan here might be a better fit next year. So those are the things we can do about the drug coverage. The other thing is the Affordable Care Act. There's going to be changes. We have a new administration. We know things changed back during the first Trump term. And some of the things that changed under the Biden administration, one of the things was during the American Rescue Act, there were some changes made to the subsidies, the tax credits for the ACA plans, Affordable Care Act plans. And that's helped a lot of people. 3 of the changes that happened because of that. One was they took that 400% income cap off, so that you didn't fall off the cliff on your subsidy if you went over it between $65,000 and $70,000 for a couple. Some families up to $200,000 income still qualified for a tax subsidy. That didn't happen before. So that's one of the changes that happened. It's people are still getting subsidy where they wouldn't have prior to that. The other was they increased the subsidies for most people. So almost every company had a plan that you could get a silver plan with 0 monthly premium with those increased subsidies. Not everybody qualified, but there would be one plan that if they fell in the right gap for the subsidies, they could get a $0 silver plan. Most times people can get a very low monthly premium on a bronze plan. The other change was they added a special enrollment period, which is still in effect right now. So it's as I'm recording this now, when you listen to this, that may not apply. That if you are below 150% of the poverty level, you can qualify for a special enrollment to enroll in a Affordable Care Act plan. All the other SEPs, life change, getting married, getting divorced, having, adding a child aging off your plan. Those are all special enrollment. Losing your coverage you have because you no longer have it through work, or you moved from one state to another, so you have to get a new plan. Those still are all going to be in effect. The one that was in addition was that 150%. In a state like ours here in Tennessee, we use the Federally Facilitated Marketplace, FFM, or sometimes just referred to as the Marketplace, or healthcare.gov. You have to be at 100% of the poverty level to get the tax credit. Anybody below below that technically would qualify for Medicaid. And in most instances in Tennessee, you're not going to qualify if you are young and able-bodied, could work and don't have any small children or not pregnant, things like that. You're probably not going to qualify for TennCare. So and if you're below that 1,000 or 100% threshold, you don't qualify for the assistance. So the other thing on that is that's probably going to go away. That special enrollment for the 150% is probably going to go away, and those increased subsidies are probably going to go away. So there's going to be some people, again, looking maybe for some options to get a health plan that doesn't fall under the ACA. I didn't realize how close I was running out of time here. One of the things we're looking at maybe doing is adding MediShare to our practice, because one of the things that came out was a good alternative when the tax penalty existed. But if you're not going to qualify for the tax credit, then you're going to need other ways to subsidize or get health insurance, and because you're not getting the subsidy. We had the 3-year short terms before. I think those are going to come back in, and the time you're listening to this program, those may be back in place. But I do expect those to come back into place sometime this year. They just haven't yet. So we still have short-term plans, but the most I can get you a plan for right now is for 4 months, and then you have to go and find another plan. But hopefully, anybody doing that now within 4 months, we'll have something that will be more long-term care. Those are some of the things that you can get a subsidy and get a plan because you don't qualify for the subsidy, and still get something that's affordable. Now, of course, most of those plans are going to have either the short-term plans you probably won't qualify for because of pre-existing condition. The other with the sharing plans they'll cover you can still get them with pre-existing conditions, but they won't necessarily be covered. They'll cover everything else. So those are some things to consider also. So if you think maybe you might be eligible for some savings, give us a call. Who knows? We may be able to find something. There are different ways we can supplement your plans that will cover certain things or if you have a high deductible plan, we have a lot of things that will cover those gaps. So get with us, and we will talk to you again next week on Insurance Matchmaking. Remember, at Matt Libby Insurance, we can cover you from head to toe. It doesn't have to cost you an arm and a leg.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.